90% of the current private hospitals, and most of them who are here, were established in the last 15 to 20 years. We have made significant strides to be able to be a representative organization that is wholesome, looks at the interests of the private healthcare space in Kenya. And as we celebrate our 25 years today, we find ourselves in a very interesting environment. This has had a profound effect on how we operate as the private health sector.
We need to be very clear. As we sit here, we are owners of capital. And I think sometimes we forget. So we need to be very clear that we have contracts addressing the legacy debt, and especially the current debt. As the kit of SHA gets bigger, and a contract has certain stipulations on when rejection should happen and when payment should be made. We are the ones who are going to carry that cost.
Over and above what we've been shown is the criteria they use for rejection. And I think it's fairly gray, and we are not able to really know what's happening there. Number 2 is on visibility of benefits.
So when it comes to dealing with this issue, what do you mean, or what is it understood as the meaning of confrontation?
I just wanted to speak to you as very key stakeholders. In the process of reviewing the benefits and the tariffs, we use a technological process referred to as Health Technology Assessment, and HTA, and all this is in the Act, which is a very rigorous process of trying to use evidence-based medicine to determine what to include in the essential benefits cover, and also the tariffs that SHA can be able to pay to the hospitals.
PPP uptake within the health sector is very minimal. In fact, we form way below 5% of the total PPP projects that are being signed off in this country. A lot of the PPP projects are usually infrastructure-based.
When it comes to public, again, we have a problem. Public-private. If I may be blunt, you have been taking advantage of the shortfalls of the public sector to thrive, which is okay. It's understandable because you are in business. You look at opportunities where government is not performing well, you excel. But I think you need to begin looking at it differently. Look at capacity that exists in the public. If it is areas of specialization that you don't have, you can find ways of collaborating.
I think healthcare sector is one of the sectors where we can't tell whether it is contracted or expanded. A year on year it is possible, but month on month that data is not easily available.
I do appreciate Kenya Association of Private Hospitals for setting up this forum today. The history that you have with the Ministry of Health and the collaboration that has been there even during the NHIF times and now with SHA.
Our esteemed representative of the Kenya Association of Private Hospitals and all private providers present, we are delighted to join you for this association's 4th annual convention. And I came with a very simple message, that public and private must grow complementarily and not compete. We have one mission which is very clear, and that mission is to deliver universal health coverage. So we are asking today the private sector to stand with us. You help us in closing gaps, help us in raising quality, and help us aligning all that we do to our national priorities for the interests of our citizens.
We are committed to stopping and not entertaining any form of fraud, wastage, and abuse. And for that, he will be joining us in launching our anti-fraud policy, our KAPH anti-fraud policy.
This is the KAPH anti-fraud policy. We are really keen in checking the compliance when it comes to the healthcare provision. And Bwana CS, we are grateful for this.